Anybody's pets, they were raised just like anything else would be, treated humanely, fed, and stuff, and then put to death humanely. Okay. All right, the rubber bands are to help keep everything kind of together. We leave the skin on the animal, it keeps it more moist and hydrated. And what the rubber bands do again is they just kind of help hold things together. So you need to get the rubber bands off. And if your rubber bands break, in that drawer, that top drawer, we got a bag full of them. And there's nothing special about it. We don't keep secrets in there. So pull it open. If you need a rubber band, grab it. Whether it's a microscope or you're working with the hearts and one of the rubber bands breaks, just grab it. So the rubber bands help to keep the panels closed that have been opened. And when we dissect an animal out and prepare it for you guys, they're called prosection. So you won't need anything except these little blunt probes that are over in the tray. And these are nice to use to point to the models as well so you don't smear the numbers and stuff on them. So just a little orientation for the cat. All right. So what I did is I made an incision right down the middle of the cat, and then I cut an abdominal panel, I cut a chest panel, and then up into the neck. And we left everything attached, so nothing was really taken out. The only thing taken out of here may have been some connective tissues that help hold things together. But let me just give you a little bit of an orientation so you know what some of the internal structures are. And we're gonna go from top to bottom. Way up high in the throat, there's a lump there, which is the voice box or the larynx. And the tube closest to the surface, it looks like a vacuum cleaner hose with the lines around it, that's the trachea. So there's a trachea. And if I pull the trachea out of the way a little bit, there's a tube behind it, and that's the esophagus. And notice how the esophagus is kind of like a sock without a foot in it. Since you don't have to swallow food all the time, your esophagus is normally closed and only opens up when you need to swallow something. So it opens as needed, but your trachea stays open all the time. You got to breathe more often than you need to swallow. So there's cartilage in there that keeps it open. All the blue tubes are veins. The red or the pink ones are going to be the arteries. Another thing the latex does is it makes it kind of stretchy like a rubber band, so they tend not to break as often. So way up high in the chest. By the way, if you're holding the chest open, I had to use scissors to cut through the ribs, and that helps the chest to stay open. So if you're in here even with gloves on, be careful about just rubbing the back there, because there's sharp little bones. You could end up breaking through the gloves and kind of ripping your finger a little bit. But at the same time, just be a bit careful. There's some sharp little bone fragments back there. So here's the heart, that little round thing right there. These flattened things that are dark brown, those are the different lobes of the lungs. So there's the lungs, and there's the heart. There's still a little bit of a sac around the heart. So there's part of that pericardial sac. And we're not going to do the arteries and veins on the heart itself. They're just too small to see. And the red and the blue don't show up very good. They don't perfuse into those arteries very well. This thin little membrane, that is your diaphragm muscle. So that's the muscle that you breathe with, and that's what separates the thoracic body cavity from the abdominal body cavity, way up here. Everything below it now is down the abdominal body cavity. So this great big dark thing on this side is the liver. This great big bag is the stomach. These are all the intestines. When we first open up the cat, there's something called the greater omentum, and the same with the human, or called a fatty apron or greater omentum, and it rests on all the intestines, and you can't see. Anybody ever seen a surgery before, abdominal surgery? Anyways, this whole thing rests on top of there, and if you grab it, it's not attached except by the stomach and the pancreas. You can lift it up, and then you can see the intestines underneath it. All the intestines, oh, one last thing to look at. This dark thing over on the side, it's about the same dark color, but much smaller. That's the spleen. So the liver is the big dark thing. The spleen is the smaller dark thing. And then there's that fatty apron. We'll just get it out of the way. These are all the intestines. And the intestines are very long, but they're all held together and foiled up into coiled loops. The membranes that hold the intestine together have blood vessels that run through them to give nutrients and oxygen to the walls of the intestine and to absorb nutrients and food and carry carbon dioxide away. So that's what's called mesentery, all those little membranes. That's important to know because two of the vessels we're going to look at are called mesenteric arteries, and so they help supply what's there. When we get down to the end of the small intestine, we get this great big tube, which is mostly empty, thank goodness, and that's all the large intestine, or the colon. So it's called large not because it's longer, but because it's wider, much wider. Large intestine, and then it goes down towards the end of the cat, and then out the rectum. In the back of the cat, this is a kidney, and here's where some of the blue latex got into that kidney. So there's a kidney, there's one on the other side I just haven't opened up. That's a kidney. This is a bladder, this little flattened bag. There's no urine really in there. There's a tube that comes from the bladder, the urethra, to the outside of the body, and this is a female. So on the outside, there's just one opening called the urogenital opening, and that's where both urine and where reproductive activities would occur. If we go up that, there are two tubes that split off. One is the urethra that goes up to the bladder, and the other one is going to be the vagina. And on the female, way up high, these little dinky things way up there in her abdomen, just below the kidneys, there's where the ovaries are at, and there's one on the other side. And cats, unlike humans, a human female has a single uterus that's shaped like your fist. Cats, though, have a uterus that has branches to it called uterine horns, so they're capable of multiple pregnancies at the same time. So on a mammal, if you look at the outside of a female mammal, you can tell by the shape of the uterus and on the outside how many feeding stations there are. And if you look at the outside of a cat, female cat, there's a whole bunch of nipples, 7 or 8, or 4 or 5 on one side, 4 or 5 on the other. And even the shape of the uterus has these horns. So when she ovulates, she releases multiple eggs. And if there's one dad, he can fertilize all of them, and she can have 7, 8, 9 kitties. Anybody had litters of kittens at their house or something? How many kittens do you get?
I used to have 6 kittens.
6 kittens, yeah. So they come out like peas in a pod, boom, 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 just squeezed out each side of the uterus and out there. So, but they got multiple feeding stations. So human female anatomy, 2 feeding stations and around uterus, 1 at a time is probably plenty, thank you. So even you can look at the design of an organism and tell how many offspring it's supposed to have. External anatomy by the number of feeding stations, multiple nipples and breasts, and then inside the shape of the uterus. So that's just kind of a little overview of some of the internal stuff that's there. Let's go through and do the arteries that are above the heart first. All right, so we find the heart, and when we go above the heart, the aorta, remember, it doesn't come up very high. It loops right around behind the heart. And on this cat, the aorta kind of got cut into, and you can look inside and see the pink color in there. You're not going to see the large vessels very pink in color because their walls are so thick to accommodate the high blood pressure. It's hard to see the latex through the thick walls. Veins have much thinner walls because there's no pressure in them, so you can see them much more clearly. So here is the heart. Coming out of the heart, the pink thing right there is the aorta. And then coming off the aorta are 2 big pipes. So here's the first of the 2 big pipes coming off the heart. That is called the brachiocephalic artery. Brachio means towards the arm, cephalic towards the head. So eventually this is going to supply blood that's going to go to the head of the animal and to one of the 2 front limbs. If we follow that brachiocephalic underneath all the blue tubes, it begins to branch. So the first branch off of that big tube is right here. And if we follow that under the blue tube, it goes up the side parallel to the trachea, to the head. That is a common carotid artery. I'm not going to ask you to identify left from right, but that's a common carotid artery. That's the first branch off the brachiocephalic. There's a second branch off the brachiocephalic. Go up a little bit further. Here's another pink tube. Follow that pink tube. It goes up the opposite side of the trachea. That's also a common carotid. So you actually have 2 common carotid arteries. One goes up the left side, one goes up the right. So we're going to stop there with the common carotids. If you follow what's left of that big tube, it heads off towards the arm. When it starts to head off towards the arm, right there and right here, it is called the subclavian. Sub means below. Clavian is the combined form for clavicle. It goes under the clavicle where the shoulder, where the clavicle collarbone would be. So that is the subclavian. If you follow the subclavian and it gets into the armpit area, the name for your armpit is the axilla. So that's called the axillary artery. If you follow that pink tube all the way out as far as you can go into the arm, it's still pink out there, that's going to be the brachial artery. And then we stop. So there's the big red tubes that come off the brachiocephalic. Let's follow the other big tube that comes off the aorta. It is already called the subclavian, just like would come off of our heart. So that next tube that's right adjacent to the brachiocephalic is the subclavian. It comes up, remains the subclavian until you get into the armpit. What do you think you'd call it in the armpit? Same name as the armpit on the other side. What would you call it over here?
Axillary.
Remember the name of the armpit? Axilla, axillary. And then it goes all the way out into the arm. What do you call it when it goes all the way out to the arm? Same name as the arm on that side. Brachial. Same names. Ta-da! So those are the arteries above the heart. So we're going to stop at the brachial in the arm, stop at the common carotids. So those are the arteries that are above the heart. Let's go below the heart now. The aorta, which you can't see very well in this view, but if we pull all the organs off to the side, keep the kidney there, put everything off to the side, this big old pink tube, it's not very pink because the walls are so thick you can't see the latex in there very well. That's the aorta. So it descends from the heart, goes all the way through the chest cavity, penetrates through the thin diaphragm muscle, and continues into the abdomen. And right here is where it penetrates through the diaphragm. Once you get in the abdomen, then we start getting a whole bunch of branches that we're going to be looking at. And these are outlined in your lab manual as the arteries that are going to be below the diaphragm. So I'll point them out to you from the top to the bottom. So the first major branch off of the aorta is called the celiac artery, C-E-L-I-A-C. It's a single red tube, the first one you hit when you get through the diaphragm. It has 3 branches. The first branch off the celiac artery is going to go to your stomach, and this first pink tube right there, that is called the left gastric artery. The next tube is going to go to your liver, and the word used to define your liver is hepatic. So the next pink tube right here is the hepatic. That one's going to go to the liver. What's left of the red tube that started as the celiac is now going to go to the spleen. Here's the spleen, and that's called the splenic. The nice thing about those 4 vessels is they're all in alphabetical order. Celiac, C, comes before gastric, G, comes before hepatic, H, comes before splenic, S. So if you remember your alphabet, you can remember the order in which they occur.
I hope I didn't fail my alphabet.
So there's celiac. So there's that first big tube. That's the most complicated vessels we're going to see branching off of here. The next major tube we're going to see is also a fairly large tube that comes right beneath the celiac, and it's going to go to all the intestines. This big pink tube, all by itself, doesn't have a partner. That is called the superior mesenteric or greater mesenteric. So it comes off right below the celiac, and it's going to serve the intestines, most of the intestines, with that blood supply that comes off the superior or greater mesenteric. Now we go down, and I'm going to skip one vessel and go to another one because it's a good landmark. When you find the kidney, there is a pink tube that goes to the kidney. Right there. And the pink tube that goes to the kidney is the renal artery, and it's paired. There's one renal artery that goes to one side, there's another kidney over here, there's another renal artery that comes off the other side. So they're paired. In a textbook or chart, they're supposed to come off the aorta at the same level. One of the things that's fun about studying a real organism is that sometimes we'll find one going off this direction and another one a half an inch below it going the other direction. Sometimes there's 2 going to one and 1 going to the other. So you see variations in normal, and you're going to encounter that in your clinical situations with the patients you work with. It's not weird or not strange, it's just a variation on normal. As long as the kidneys are getting something off the aorta, whether it's the same location, 1 to each side, 2 to 1, 1 to the other, they're at different locations. As long as they get there, it's going to work. In between the superior mesenteric and the renal artery are 2 little pink ones. The 2 little pink ones are very small, 1 on each side, and those are called the adrenolumbar or the suprarenal. Your adrenal glands sit right on top of the kidneys, as you remember from the lab exam. So adrenolumbar, lumbar's lower back, or suprarenal. So those are between the superior mesenteric and the renal artery that was in the kidney. Let's move down the aorta. Now there's a pair of very small vessels that are going to go to the reproductive organs. This pink tube here and this pink tube here are called the gonadal arteries. The polite biological name for your ovaries and testes is gonads. So the safest term is gonadal artery. We know this is a female cat, so if you would call that the ovarian artery, that would be correct. But if you would say, oh, that's the spermatic artery, you would be incorrect because this is a female cat, not a male cat. This doesn't have any testes. So that would not be the spermatic or testicular. That would be the ovarian, but the safest name would be gonadal. 1 off to one side, 1 to the other. They're paired. Go down a little bit further. The next pair of arteries, I've only got a little stub of one of them. There should be 2 of them, 1 to the left, 1 to the right, and they should be coming off the aorta at perfect 90-degree angles. Look at the blue tube beneath it. That's the vena cava. Do you see that blue tube right there? And the other blue tube right there that are coming off the vena cava? They're almost like at 90-degree perpendicular to the direction of the vena cava. Those are called the iliolumbar veins. There are also iliolumbar arteries, but they got broken off here. I've got one. The other one's not I got a fragment of it, but it got broken off of there. The other cat, the male cat,